congratulations, welcome to our program. You got your medications, what do you do with them now? So most likely you either got testosterone, a peptide, or HCG. Testosterone is an oil-based substance, it's thick, and because of that, it's not something you want to put in your refrigerator. You want to leave it at room air. If you put it in your refrigerator, it's going to curd up, not good, okay? Because it's oil-based and because it's thick, your packet's going to come with two different types of syringes, okay? One that's large bore, meaning the diameter is like this, okay? That's going to make it easier for you to inject, and one that's small bore, okay? You don't want to put a harpoon into your legs. That's why it comes with the smaller syringe to inject. If you use a smaller syringe to pull it out of the bottle, it's going to take you forever. And it's also going to dull the tip a little bit. Males, okay, there's a couple, ideally in males, it needs to go in your muscle, okay? So this is gluteal anatomy. Anywhere in the upper outer part of your glutes is safe. Anywhere up over here, okay, down below, along the bottom part of your glute, there's nerves. You don't want to do anything down there. Anywhere up over here is safe. There's a big shield of bone underneath that. That's where you want to inject, okay? Alternatively, okay, you can inject in your quads, and that's how I did it for the whole first year, okay? So the upper outer aspect of your quad is very safe. It's a thick muscle. Along the medial aspect, okay, that's where your blood vessels are. You don't want to go anywhere by your groin. You want to go anywhere out along the quads, as you see here, okay? Females, since you're only getting a couple drops, you're going to pinch the love handles of fat and put it in with the small needle, okay? Peptides, HCG, okay, always keep refrigerated. They could denurture within about 30 minutes of being left out, okay? So if you travel with them, roll them up in ice packs, but keep those cool. And if you leave them out too long, then what I suggest you do is call the pharmacist, call the pharmacy, and see if it's indicated to actually replace it. But that's on you to keep it refrigerated, okay? So come over here, let's show them how we do the injections. Okay, so most likely you're gonna have this for your peptides, females for the testosterone, okay, and these syringes for the male testosterone, okay. So for the peptides and HCG, this is what you're gonna do. Now, to keep things sterile, okay, you don't want to try and touch anywhere that is gonna come in contact with your skin. This is the area through which we're gonna aspirate from, okay. So what you could do is just put a little bit of alcohol over it, rub the alcohol on the site where you want to inject, okay? Now notice I'm never touching the actual needle, okay? Because that's going to come in contact with my skin. What you want to do, because this is a vacuumed situation, you want to put a little bit of air in, turn this upside down, go right through the diaphragm, push the air in, it displaces the fluid you're going to take out, okay? So for the HCG in males, for example, usually if it says 0.3, that's how much you're gonna do, okay? You're gonna pinch your love handle, bury this in, and just push it all in, and then dispose of the syringe, okay? So that goes to the peptides, that goes to the HCG. The testosterone, on the other hand, okay, this is what it's gonna look like, okay? Like I said, you're gonna have a large bore needle, okay? And notice I'm never touching the tip, but this is a harpoon, okay? That's a thick syringe, that's a thick needle, okay? That's not something you want to put in your tissue. Don't ask me why I know that. Some of our patients have, okay? So, but this makes it easier to draw the oil out. So again, you're gonna put some air in, okay? Push the air in to displace the fluid, draw back, okay? Now, I'm gonna push some air in like this, okay? Because now I'm gonna change out this needle. I'm gonna go like this, take it off, you're gonna dispose of this. Now this is a smaller caliber needle. This is the one you're gonna inject with. Notice I'm never touching anything that's gonna go against my skin. Now there's air in there. If you put that under your tissue, it's gonna irritate things a little. So I displace the air, okay, until I see it just going into the syringe, okay? And at that point, we're gonna inject either in the quads, up over here, okay? One way to do it is you can lean against your bathroom sink, look in the mirror, and do, 1 week here, the other week here. The other option is to, pinch your quads. And I know it's a long needle, but it needs to go into your muscle, okay? Usually they're not this long, usually a little shorter, but it needs to go into your muscle, okay? Any questions or concerns, you can email my team. You can reach me at amathey@nygetfit.com. Once again, welcome to our program.